For many years, neuropsychologists had pursued these centers in the brain in an attempt to link them up and understand the hardwiring of emotion. In 2011, two neurosurgical units, together with some psychiatric colleagues, decided to embark on a study. The center of the production of dopamine is an area called the nucleus accumbens. And so they selected 8 patients who were in terminal hopeless helpless, who were no longer responsive to their drug therapy, to electroconvulsive therapy, and in fact were pre-suicidal. They were totally unmotivated and in fact could no longer get up in the morning to engage their lives. And they asked them if they wanted to be involved in a medical experiment, and the experiment would be to try and maintain the stimulation and the production of dopamine. And they were very happy to sign up their consent for this procedure, which was in fact very experimental. And the plan was to insert deep-seated electrodes into the nucleus accumbens, which is approximately 8 centimeters deep from the surface, and to link these stimulators to a pacemaker and so maintain a pacing of the nucleus accumbens, which should produce a sustained amount of dopamine. And so this experiment was performed, and these individuals, these 8 individuals, were studied over a period of 3 months, and it became very apparent that they required less and less drug therapy and became far more meaningful, motivated, and engaging. But they noticed something very strange. These individuals were very chilled, they were very relaxed, and this was not part of the expectation of this particular experiment. And so they decided to put them into a PET scanner. That's not a CAT scanner, that's for cats. This is a PET scanner for pets. No, it's not a PET scanner for pets. It's in fact a positron emission tomography scanner, a PET scanner. The PET scanner in fact analyzes which parts of the brain are the most active at that point in time. And so they went into this machine, and as expected, the nucleus accumbens was highly active because that was being paced. But then they noticed something very strange. The amygdala, the seat of fear, anxiety, panic, and rage, was completely silent. So it became apparent that the nucleus accumbens and the amygdala work in opposition to each other. So when the nucleus accumbens is highly stimulated, it suppresses the amygdala. So hopefulness, meaning purposefulness, a sense of achievement, gratification, suppresses the negative center, which is the seat of fear, anxiety, panic, and rage. And this was very intriguing. And the next part was to see, in fact, if we could stimulate the amygdala, would that have a negative effect on the nucleus accumbens? And this was, in fact, done chemically. And sure enough, stimulating the amygdala suppressed the function of the nucleus accumbens. And this is a very significant finding, because what it means is that when one is fired up, one is gratified, motivated, one is driven towards meaning and purpose, and one is driven towards a sense of achievement, then one suppresses the negative emotions of fear, anxiety, panic, and rage. Conversely, when fear, anxiety, panic, and rage are stimulated, the nucleus accumbens is suppressed. And this has major relevance in terms of the early nurture years. In the early nurture years, the thing which is required is feed. And if in fact feed is not forthcoming when it is required, a sense of fear or anxiety will kick in terms of the infant, for fear of not getting the feed which they fear that they will not get and which they need, and hence this anxiety reaction that is in fact the low glucose-induced raised pulse rate, blood pressure, and sweatiness, which ultimately will become the anxiety reaction, becomes integrated at that point in time. As soon as they get their feed and the blood glucose levels rise, they experience a sense of gratification, and this switches off the fear which is based in the amygdala. And so this dynamic, this need for feed, this anxiety of not getting the feed, the fear of not getting the feed, and the switching off of this negative situation by receiving the feed, which is in fact rewarding and pushes up the dopamine levels, creates the foundation for this infant in future life. This is in fact defining the relationship of fear, anxiety, and the attitude towards reward, all laid down in the earliest years, in the earliest circuitry. This then is the hardwiring of emotion as based on these important centers. We can now define, based on these responses to feed, the delay in getting the feed, and the gratification in receiving the feed, the reward, can be defined on the basis of three situations, which may later become the three archetypes. And these are the three archetypes, in fact, which give rise to the foundations of the triangles model, the model which provides the platform for accessing of the chemistry of wellness and performance and leadership. And so we can recognize these three situations or three archetypes. The first of the three is the individual that had very little deprivation, maximum gratification. There was very little delay in receiving the feed for the need at the time. This individual has more than enough dopamine and serotonin and low levels of noradrenaline. And in fact, this is in fact their only problem, is the low levels of noradrenaline, because this might affect them in terms of engaging. But this individual is very self-confident, self-sufficient, and has very little in the way of deprivation as manifests in this chemical configuration. The second of the two is the individual who had a degree of delay in receiving their feed for their requirements, but ultimately did receive their feed just within a threshold period of time. They have adequate levels of serotonin and dopamine. They have very high levels of noradrenaline, and this in fact is their biggest problem, because in fact the high levels of noradrenaline will affect their function in terms of their prefrontal cortex, and will also lay them open to raised levels of pro-inflammatory cytokines should the noradrenaline levels be sustained at very high levels. The third situation or archetype is the individual that received very little response to their needs. This was a situation of high deprivation, and in this particular situation there is this fear that their needs will never be met. They eventually develop a mind state of futility. What's the use of even trying? I never get my needs met. They have a very low self-esteem as a result of their needs not having been met. They have very low levels of dopamine and serotonin, high levels of noradrenaline, reflecting this great fear. And in this particular situation, the pro-inflammatory cytokines are very high, giving rise to all the negative effects that we had spoken in the section on the chemistry. One needs to appreciate that although one has emphasized the feed as part of the nurture dynamic, we know that nurture incorporates many other facets which are all reflected in the triangles model, which reviews nurture as a fundamental origin and subsequently evolves into the individual and manifests in their full spectrum of life, being personal, interpersonal, work application, and recreational. This would have to be examined in detail in the triangles model module. In terms of the work application aspect of this chemistry, this has been recognized more recently as being fundamental in terms of the enhancement of performance and leadership in a corporate environment. So much so that Forbes magazine has actually produced an article referring to the incorporation of neuroscience into the corporate environment and the enhancement of performance and leadership. And I quote from the end of this article: "Companies that effectively match emerging knowledge about the brain with profound human needs have a shot at striking gold." This then is the overview of the chemistry of the triangles model. This model provides the coach with an enormous extended platform for the coaching modality to intervene and to access directly with the chemistry of wellness, performance, and leadership.